Hi guys, we're team number 7 and our topic is capacity planning for services in the short run, long run, and in a crisis. We split ourselves into 3 different groups covering 3 different companies for today's presentation. Michael and I would like to start off by talking about capacity planning in the short term. Capacity planning in the short term entails coming up with solutions for different issues, such as how to manage a company's inventory, how to budget for labor, and for the people working with you, including the shifts that they're on and what different people in your company are running. And how to balance resources for multiple stores, along with other issues that fall within this realm. The company that Michael and I are going to be looking at today is Old Navy. For those of you who might not know what Old Navy is, it's a clothing store that is well known for its relatively inexpensive summer clothing as well as its young adult clothing. Because there's over 1,000 Old Navy stores worldwide, it's important for Old Navy to use capacity planning in a way that allows for their inventory trends and systems to work. They use their patented inventory management system in order to keep on top of their trends, allowing for them to know what's selling and what they're looking for in the weekly and monthly and quarterly in terms of like sales and what different people are buying and things like that. This means that all of their summer inventory must be sold out before they can move into their fall lines, because you can't have too much of your old inventory in with your new inventory, because then it would get confusing, and also you just don't have enough room for that in most stores or warehouses. This also means ensuring there's enough people to keep up during the busy periods, which relates back to budgeting for labor hours and during the busiest and the slowest times. During the normal summer months, obviously not going to happen now with the current events happening. Old Navy is asking themselves the 3 key questions to capacity planning, which are what kind of capacity is needed, how much of the capacity is needed, and then when is the capacity needed, and they need to be able to answer all of these questions in order to run an effective store and make sure that they know how many people to schedule and what inventory needs to be coming in and out and things like that. And now I'll pass it on to Michael, who is going to talk to you a little bit more about Old Navy and the gap split and how that affects resources for both of the companies. Thank you.
All right, thank you, Katie. Hi, I'm Michael. Continuing with the company of Old Navy and some examples of the ways that they use short-term capacity planning, I chose to look at an article from a business news site called Reuters. This article is called Gap's Old Navy Plans to Nearly Double Its Store Count After Split. The article talks about how the Old Navy was able to look at what happened next for them as a separate company. It says, as a standalone company, Old Navy, which offers more affordable clothing and accessories, plans to open 860 stores in North America, and said it would focus on opening outlets in smaller markets and off-mall locations. This projected their net sales to increase from $8 billion to $10 billion. One issue that can arise from this is how both companies plan to balance the resources between the stores. However, it seems that they properly display many of the practices that we learn about every day in ops, so they can expect to see results that they want unless something major goes wrong. This relates to our class because it seems that we are always using projections and algorithms to find data that can help us to lead to estimates about our future possibilities. We can see it in many instances, and in this situation, they're able to use it and they hope to see a big profit from it.
All right, so now that we've talked about the short run and the long run of capacity planning, Gus and I will talk about capacity planning for a crisis situation. First, before we get into our example, I want to talk about what capacity planning in a crisis really is. Capacity planning for a crisis is processing and determining the amount of production needed when demand goes beyond what is currently normal, and finding alternatives for the demand if it can't be met immediately. So basically your evaluation of demands. You also want to have cost analysis and kind of just like regulate your operations cost to provide the proper amount of supply for the new demand. For example, we're going to be talking about hospital crisis situation, and surge capacity is kind of like the crisis in the hospital, and surge capacity is the ability to evaluate and care for an increased volume of patients, and that comes in 2 forms: a short-term surge and a long-term surge. Short-term surge is basically like when an airplane crashes or like an earthquake happens and there's a increase in the volume of patients. And then a long-term surge is kind of more like a pandemic where there is patients that are coming in for a longer period of time, over like a month or more. So that's that. And then with that being said, we wanted to focus on a long-term crisis of COVID-19 for the remainder of our presentation. We narrowed it down to the Swedish Medical Center hospitals in Washington and found some numbers for that. And Gus will continue with some specifics on our example.
My name is Gus, and I will now proceed to give the specifics of our example. The Swedish Medical Center is the largest non-profit health provider in the Seattle area. They operate 5 hospital campuses: First Hill, Cherry Hill, Ballard, Edmonds, and Issaquah. In total, they house 1,571 licensed hospital beds. They employ just under 13,000 workers, a third of which are practicing physicians and allied health professionals, and in 2019, they had just under 2.3 million general outpatient visits. Following the outbreak of COVID-19, the Swedish Medical Center in Edmonds increased its number of ICU beds from 13 to 33. They increased its number of negative pressure rooms from 8 to 28. They currently have 23 ventilators on hand, but are still needing more. Later reports show Swedish's ICU beds have been completely full during the peak of the COVID cases, and other figures pertaining to the hospitals within the greater Seattle area show doubling and even tripling in the number of ICU beds and negative pressure rooms. There are many measures that Swedish has taken to increase their surge capacity and meet the demands of their patients. Here are a few. They've postponed elective surgeries to free up space for medical patients with the decrease of surgical patients. They've begun to use trailers and external portables to increase surge capacity. They've enlisted the service of Microsoft to develop an app to track the volume of COVID patients, amount of PPE on hand, and hospital capacity. They've closed floors in its birthing centers to free up more room for the influx of patients, and they've converted a homeless shelter into a 45-patient recovery center. All of these actions were done so in an attempt to increase the surge capacity of the medical centers and allow hospitals to increase the amount of patients they can serve, escalate safety precautions, and tend to the demanding needs of the delicate public health of the community. These positive actions in unison work together to give Swedish medical centers a competitive advantage over the rapidly spreading disease.